Hi, welcome back. We are up to chapter 6, theoretical framework. In this PowerPoint presentation, we're going to be discussing hierarchy of literature, literature review, and conceptual frameworks. We are now in week 5. So you guys are doing great. I'm really proud of you. I know that research is a difficult subject to master. And you are slowly but surely building the foundations to understanding and grasping how to do a comprehensive research project and literature review. So here we go. First thing I wanted to review in this particular PowerPoint, again, is the hierarchy of evidence. You're going to notice that there are multiple versions of this particular pyramid that offers you the different levels. As we had said before, and many times I'll just keep reiterating it, the top 2-3 levels are the highest levels of evidence. And that's where you want to focus getting your research and your articles from, is research that's based around level 1, level 2, and level 3 evidence. Now, you have to remember the evidence pyramid is often used to illustrate the levels of evidence in literature. And you always want to begin at the highest possible tier. Filtered information is pre-appraised, and the filtered information is your top levels. This means that the content has been filtered to include studies and reviews that are of higher quality. Keep in mind that the amount of available literature and the number of problems covered gets smaller as you move up the pyramid, which makes sense because as you go up the pyramid, you're working with research that, it's harder and harder to find quality research because it really requires an in-depth level of knowledge and application to human subjects. So obviously it's harder to get that information and have access to it. This information down here in the lower levels, which is considered unfiltered information, represents the original studies. However, these tiers may not contain studies of high quality or strong evidence, but they do cover a broader range of clinical problems and are much more available. Again, it's harder to get higher quality stuff, but that's what you really want when you're basing and doing your own research. So I like this pyramid because it actually labels each level 1, level 2, level 3. Now, like I said, you're going to look up these pyramids, the hierarchy of evidence, and you're going to see all different versions of this. You may even see versions that don't have this many levels. It may be condensed to 5 levels. Don't get confused. The important thing is to look at the wording used within your research, okay? Systematic reviews versus meta-analysis versus randomized controlled trials. Now, I know that gets confusing as well. So what I did in the next few slides is I went through each particular level, specifically looking at what each one is composed of. So what is a systematic review? What is a meta-analysis? What are randomized controlled trials? So just follow along with me here. I particularly like this pyramid diagram the best of all of them. For a couple of reasons. Number one, it just seems a little more simple, less verbiage so that I can really look at it very clearly at each level. I also like how it points out here on the side that this level, randomized controlled trials and lower, are considered unfiltered versus the top 3 tiers here, or top 2 basically, as appraised and filtered. Just looking here, I want to just point out something. This meta-analysis and systematic reviews, this pyramid in particular has it broken down into what looks like 2 levels, but this would actually be considered level 1 in most pyramids, okay? So just so you know, meta-analysis and systematic reviews both fall into level 1, and then we fall down into 2, 3, 4, 5, 6, 7. For our studies, we're using 7 and 8. I mean, the levels can actually be broken down into 8 levels. But again, I don't want you to get so focused on the different levels as opposed to what each level contains. That's what's important, because no matter how many levels a pyramid has, the studies themselves are what show the quality of evidence. Okay, and the other thing I like about this pyramid is that it gives you the sources of where you can find what websites, the PubMed versus CINAHL, to find these particular sources of information, where you're going to find the higher levels of evidence. Okay. So here we have level 1. This breaks it down for you. So level 1, again, we're looking at meta-analysis and systematic reviews. Now, I talked about systematic reviews first because I want you to understand what that is so that you can understand why meta-analysis actually goes above it. So systematic reviews summarize information from multiple articles and studies that address the same clinical problem. So that's a bunch of different research articles all put together and reviewed. Systematic review usually focuses on specific clinical questions and conducts an extensive literature search to identify studies with sound methodology. The studies are reviewed, assessed, and the results summarized according to a predetermined criteria of the review question. So similarly, we used our meta-analysis grid to do systematic reviews on your particular research topic. That's what we're doing. A meta-analysis, which is composed of a systematic review, is the statistical analysis of the article and studies. A meta-analysis takes a systematic review one step further by combining all the results and using the accepted statistical methodology. So the meta-analysis really takes all the numerical values that these systematic reviews kind of summarize and puts it all together. So the two really work well together, obviously, and produce the highest level of evidence, which is level 1. Next, we have level 2. And here we have, it's called the critically appraised sources. Now, just want to point out here, this is like an all research I've noticed in this particular topic of research in general. They use a lot of different words that all mean the same thing. So they have a lot of definitions of the same thing, which gets it very confusing. So for instance, in this particular pyramid, they call it critically appraised sources. Other pyramids call it evidence synthesis, and other pyramids call it synopsis of synthesis. So what's the key thing here? Just think of synthesis and critically appraised. Those are your two words to kind of show you what level of evidence you're at. Now, what does this mean? Critically appraised sources, level 2. Several journals have sections where they highlight critically appraised evidence and tell you how strong the evidence is. Authors of critically appraised topics evaluate and synthesize multiple research studies. They are also called synopsis of synthesis, which have structured abstracts, brief overviews of published systematic reviews that have been screened for methodological rigor. Synthesizing research publication entails categorizing a series of related studies, analyzing and interpreting their findings, and then summarizing those findings into unified statements. So this is basically just an extension of systematic reviews in that they took the systematic reviews, like several journals, which are systematic review journals that they're reading, articles that they're reading that are technically systematic reviews, and they're really making sure that they've analyzed them and that they actually followed all the rigorous protocol of research to be considered technically critically appraised. Okay, but again, this all falls in the higher levels, level 1, level 2. Okay, next we have the randomized control trial. Now, technically, the RCT definitely falls in like level 2 evidence, okay? RCT, randomized control trials, is a trial in which subjects are randomly assigned to one of 2 groups. One of the groups, the experimental group, receives the intervention that is being tested, and the other group is the comparison group or the control group receiving an alternative conventional treatment. Randomization reduces bias and produces a rigorous tool to examine cause and effect relationships between an intervention and an outcome. Now, in terms of randomization reducing bias, that's an important thing I want you to also remember. In terms of the pyramid itself, we're looking at the levels of the pyramid, again, based on how much bias each one has. And remember, as you go higher up the pyramid, you have less bias. That's going to give you a higher quality research-based evidence. Okay, next we're getting down into the lower levels, the unfiltered, and we're talking about cohort studies, okay? Cohort studies are a type of longitudinal study, like a long study, okay? Cohort, remember, means group. So we're looking at a group along a long time period, longitudinal study, an approach that follows research participants over a period of time, often many years. Specifically, cohort or group studies recruit and follow participants who share a common characteristic, such as a particular occupation or demographic similarity. Okay, so again, this is a longitudinal study. It's a longer study done over a long period of time, and cohort again means group. Okay, so we're looking at a group of people that have something in common over a long period of time. Next, we have our case control studies, okay? Again, we're in the lower levels now. We're looking at less quality evidence here. A case control study is a study in which patients who have already have a specific condition or outcome are compared to people who do not. So we're looking at two groups of people, similar to cohort, we're looking at two groups of people. This group has a specific condition versus a group that does not have it, okay? Researchers look back in time retrospectively to identify possible exposures. They often rely on medical records and patient recall for data collection. And then the individuals are separated by their disease. Okay, so it's a case control study. Okay, then we have case reports, case studies. We're almost at the bottom here with the least amount of evidence. Now, case reports and case series. I want you to also remember looking at the title of the particular level on the pyramid, like for instance here, case reports and case series. That right there can tell you it's just a report. It's nothing, it's not a study. There's no study. When we start to look at studies, we're getting higher. When we're looking at trials, we're getting even higher. When we're looking at systematic and analysis reviews, then we're even at the highest level. Okay, so use keywords to help you identify your levels, because not only are you looking at the keywords to identify the levels on the pyramid, you're looking at these keywords when you're reading your research articles to determine what their level of evidence is. Remember, in your research, when you're doing your literature reviews, they're not going to specifically say, oh, it's level 1, level 2. I mean, it's great if they do, but the likelihood is they won't. So how are you going to know? You're going to look for keywords, case control study, case reports, background information, expert opinion. Then when you start to see those words, you're going to say, now I know where it falls on the pyramid, so I know how to classify it in terms of the evidence levels. Now, hierarchy of evidence is the name of this particular pyramid. That's what the research world calls this pyramid. But keep in mind, the reason for this particular pyramid is specifically to determine levels of evidence. So when you look at this pyramid, think of hierarchy of evidence, but also think of levels of evidence, levels of really good sources of information that are actually quality evidence. So then we have, of course, at the base of the pyramid, level 7, which is the lowest level. This is considered background information or expert opinions. These could be ideas, anecdotes, or editorials. And again, this is the least reliable evidence, which comes from ideas, opinions, and just random people's opinions that they write about, whatever the topic is. When I did my medicinal marijuana research project, I have to tell you, I did my literature review, and like a large majority of my research I was finding as I was doing my review was at level 7, because it was just a lot of opinions, very strong opinions on, what medicinal marijuana represented and what it was good for. But the studies themselves, it was very hard to find filtered evidence. Okay, so again, coming back to the fact that number 1, there are a lot of different versions of this pyramid. So you could Google hierarchy of evidence pyramid, and you're going to find a million different versions of it. Use all of them, find one that works for you in terms of really grasping how to look at it and understand it. But again, as long as you understand the verbiage in each level, you'll start to understand where the level of evidence falls that you're looking at. So meta-analysis, systematic reviews, again, those are your top level. Now, again, they break it down here into level 1, level 2. Most pyramids make this just level 1. Okay, this one has level 2 as randomized controlled trials. Then you have 3, 4, 5, 6, 7. Okay, and this right here is an example of how somebody was doing a literature review and what they came up with in their research article. So right here, they did in their research, they found 1 systematic review with a meta-analysis. So right away they knew that's level of evidence 1. In their research article, they found 4 randomized controlled trials. Okay, so they, in this pyramid in particular, they classified it as level of evidence 1. So it could fall between 1 and 2. All right, just depends on the actual research and the actual trials that are being done. Here, they also found 8 systematic reviews, level of evidence, number 2. Okay, fine. 10 prospective studies they found in level 2. Okay, and then many retrospective studies and case reports, levels 3 and levels 4. Okay, remember these words, retrospective and prospective, they fall in in your case control studies, okay? And so that's where you have to remember these verbiage in particular in each level, so that way you can really understand what level it falls in. Okay, so what we asked you to do in terms of the literature review last week during your group work was do an annotated literature review. And all that means is it's like a condensed version of a literature review. An actual literature review is a long written out paper that really summarizes, different things within the article. This, when you do the annotated version, is basically the Cliff Notes. And from this, all this information you pulled from those articles, you then can get a gist of, is this article, in particular good for my research topic? So now you have all this information, you can make a quick decision as to whether or not you're even going to use it. So, okay, let's say, yes, it is good. Now we can use this information to write out a full literature review, which is what we're going to do in our group work today. So a structure of a literature review. So this is very basic, but I just wanted to go over it. I mean, it's pretty simplistic. You're going to have your cover page, your introduction to demonstrate the importance of the research topic and outlines the direction of the review, including the thesis, the research question, the scope, and the purpose. You're going to have the body of the review, which synthesizes and analyzes the sources in a clear, logical manner. Of course, you're going to have your conclusion, which addresses the gaps in the knowledge, indicates what your analysis tells you about the thesis or research question, and provides direction for future research. And then you're going to have references, like list all the sources you cited in your paper in APA format. Here's a link that actually gives you a really nice template to help guide you as you're writing your literature review. This is a very basic template, but it's a nice starting point. And Professor Kavanaugh will definitely go into, the exact details or certain particular things she wants to see in your literature review. We'll talk about that in group work today. Okay, the next thing we need to talk about is the conceptual models and theoretical frameworks. Hopefully you guys read chapter 6, which is what, basically was a full chapter all about theoretical frameworks. Now, we got into this in your discussion board question number 1. And a lot of you caught on real quick. I provided this box down here with the different models. This is a very, very brief amount of actual, list of all the models that are out there. There are a lot of models, okay? Sometimes researchers actually make these models up as they make their research. They create a new model. And you could do that too. If you decide you want to create your own model, go for it. But that being said, we're new researchers, so we're going to try to stick with what's already out there and not reinvent the wheel here. But in your discussion board question, the assignment was, and some of you did this and some of you, tried, but you didn't go through with the whole thing. The idea was to take the model and apply it to your clinical situation. A lot of you just listed which particular model you would use in that situation, but you didn't actually identify how to break down the model for your particular situation. And that's the key here. The model is supposed to be used as an organizational tool and framework to organize and interpret the research. A lot of the times people do their research and then they decide which model they're going to use. Some research pick a model first to help guide their research, and that's how they develop which research they're going to use. But keep in mind, again, back to like the levels of evidence, a lot of the research you're going to find, the literature reviews you're going to do, they don't list which model they're using. They just pick a model and go for it, or they may not even use a model. But I got to tell you, if they're not using a model, it's really not probably the best research you're going to find. The models are very, very organized and used to frame the research so that it gives it a structured methodology. So here I wrote this just to remind you, it's an organizational interpretive tool. Don't make the model this complex foreign thing that you can't grasp. It's literally, they use the concept maps like I had showed you in the last lecture. They break down the models into conceptual mapping. So it's step by step. And basically they take an overall theory and they break it down into steps. And so the framework is theoretical and the conceptual model falls into baby steps. And that's how they break it down. So, you're going to hear the words conceptual model and theoretical framework used interchangeably. They go together. They're one and the same, right? Because you have a framework and then the conceptual model falls into the framework, okay? So as a researcher, you use the models as a framework to conceptualize and operationalize the constructs of your research with the model in mind. So let me give you some examples, okay? Here we have Pender's health promotion model. Now, my question is, can you somehow apply this model to your research study? Now, when I was doing my medicinal marijuana studies, I had no idea what model I wanted to use. But what I did know was I wanted to change the attitudes and behaviors of healthcare practitioners in terms of how they felt about prescribing it and how they felt it was going to either help. Well, I wanted them to, change their attitudes and help them understand that it could potentially help a lot of their patients with chronic illnesses or whatever things they had going on with them. So how I applied this particular model to my research. And how did I do that? Okay, so you want to look at the framework here. What is the framework of the health promotion model? First things first, you're looking at the individual's characteristics and experiences, right? So who am I looking at here? I'm looking at my nurse practitioners that are new grads that really don't have much experience. Most of them don't. They don't really know much about medicinal marijuana. They certainly don't know about prescribing because they haven't prescribed yet. And they don't have, most of them didn't really have much experience with any patients that had been taking medicinal marijuana. Me as an RN, I worked in home care, and I experienced a lot of patients who were utilizing medicinal marijuana for pain, cancer, side effects of chemo, that kind of thing. So you have to look at the individual characteristics and experiences of your subjects, right? You want to look at their specific behavior, cognitions, and affect, and you want to look at the behavioral outcomes, right? So in terms of the prior related behaviors and personal factors, this is how we break it down, and then you take it from there. So prior related behavior, then we want to look at their perceived benefits of action versus their perceived barriers to action, perceived self-efficacy, and activity-related affect. We also want to look at the personal factors. I was looking at what are the interpersonal influences of these nurse practitioners around the thought process of medicinal marijuana. Like, how did their family feel about it? Was it a stigma? Was it a negative thing? Did they think it was dirty? Did they think it was, they were going to get, backlash from their peers for, positively promoting it? What was the influence around them? And then same thing, situational influences. Did they think it was going to be like a stigma in their practice if that was something that they were going to participate in? And, this is when we came into the commitment to a plan of action. And that's where I came in with my research. If I gave them an instruction manual or some kind of guide to educate them on the use of medicinal marijuana and how it helps people, how to prescribe it, the things to warn the patients about, like, would that help change their behaviors about it? And again, I'm promoting a healthy behavior, a new positive outlook onto how to prescribe and why to prescribe. So that's how I applied the health promotion model to my particular research. Health promotion model could be to any kind of behavior you're trying to promote to change for a healthier change or behavior in somebody. So you could be doing it just like in the study we read on the diabetics and changing their behaviors in terms of managing their blood sugars and making healthier food options. We could definitely apply the health promotion model in that research project as well. Anything you want to use to promote healthy changes, this is a great model to use. Here's another model, the conceptual model of stress and health outcomes. And in this model, which I took straight from your textbook, they use it in an example in patients with cancer. Now, keep in mind, this model could be applied to any patients with any disease process because all disease processes cause stress. So if you really want to look at how stress is affecting that particular patient with that particular disease process, you could use this one. So how did they apply it to cancer? Okay, cancer diagnosis and treatment was made, okay? Appraisal of the situation. How did the patient feel about the situation? What was their reaction? And then you're going to look at all the different parts to this particular patient. Personality factors. What kind of person is it? Is it a negative person? Do they normally try to look at the bright side of things? Do they look at the negative things, half empty, half full kind of thing? What is their social support? Do they have family to support them and give them positive motivation to try to get better and to get through the treatment? What is this patient's coping skills, right? All of these factors are going to obviously affect the patient's stress level. So this is how we break down assessing and evaluating, the outcome of their reaction to the stress from their disease process. And here they looked at, their immunologic and neuroendocrine function. Is that going to have an effect on their stress? Obviously. And from those different breakdowns within the model, then we come out with our outcomes: the health status, depression, eating, sleep disorders, treatment decisions, mood. These seem to be all negative outcomes. Obviously, with cancer, you're going to obviously have negative outcomes, but it may not always be so negative. Just keep that in mind. This is just this particular example for this model. You could end up having positive outcomes. They could, after they get through the initial stress of it and the treatment works and suddenly they don't have cancer anymore, or it's in remission, depression may turn into, happiness and gratitude. Just keep that in mind in terms of the outcomes. Okay, here's another theory, and this one is not so much a concept map, but a circular sort of diagram, because what they want to point out in this particular theory of self-management process is that a process is always ongoing, and sometimes with different variables, obviously it changes. You can go backwards, you can go forwards. It's circular in nature, so there's just this constant change of different versions of where they're going to fall in it. All right. And in this particular one, the grounded theory of self-management process, they did it in adolescents and young adults after a stem cell transplant. So again, this example came right out of your book, out of your chapter. So you can look at it if you wanted to. But in this process, it starts with at the mercy of the transplant right here. So this is where it started. They got their stem cell transplant. And then it proceeds through the cycle. And so it's all interchangeable. Everything happens at different times, but it's constantly going. So at the mercy of the transplant, the teenager got the stem cell transplant. Now, what's the setbacks? What education and instructions were they provided with? And now are they accepting their new normal? Do they have social support? Are they yearning for being normal again and not having had to undergo something like this? What kind of inner strength and motivation do they have? All of these factors are going to influence the outcomes of this patient and how they self-manage dealing with it. Okay, so that's pretty much it. Again, there's a million different theories and conceptual models out there. Find one that you like, that works for your particular research subject. Really try to focus on a concept model that you can actually apply and understand. Some of these models get very complex. Don't pick that one. Pick ones that are easy. Iowa model, health promotion model. Those are pretty basic ones that a lot of the researchers use. It's pretty basic, framework that you can just literally fill in the blanks as to your particular subjects. The other big thing about the concept models is it helps you come up with a hypothesis. It helps you kind of think about what your outcomes are going to end up being at the end of your research. And then you hope that you're on point. And the concept model guides you in that direction. But either way, at least it gave you a structured viewpoint and methodology to get to that point in the research world, which again is very formatted and very specific so that it actually looks and is legitimate. All right, we're going to break into group work now. We're going to do the breakout rooms. We're going to go over the hierarchy of literature that was assigned for the 2 articles that each group had. We're going to look at the quality of evidence. We're going to review the completed full annotation, and then we're going to have to show you how to apply that to do a full literature review. Professor Kavanaugh is going to talk about that. All right, thank you.